Bismillahirrahmanirrahim. This is Dr. Rustam Khan with Saras Medical Stuff. In today's lecture, I am going to tell you about the common investigation in liver and hepatobillary disease. As the word hepatobillary indicates the liver and the biliary tree, bile duct like cystic duct. So let's begin with these investigation. So first I am going to tell you about the liver blood biochemistry. It includes serum bilirubin, alkaline phosphatase ALP, and gamma glutamyl transferases GGT. Gamma glutamyl transferases. And the fourth one is alanine aminotransferase ALT, and the fifth one is aspartate aminotransferase. Keep in mind that all these above tests are not truly function tests. They do not tell us about the function of the liver. We call it liver function test, but they truly do not tell us about the function. They give idea about the hepatocyte injury more than the function of hepatocyte. Function of liver or hepatocytes is assessed by the prothrombin time, serum albumin, and bilirubin. So function is best assessed by the prothrombin time, serum albumin, and bilirubin. So now let's come to the serum bilirubin and albumin level. The degree of elevation mean the rise in the degree of rise in bilirubin level can reflect liver damage, but keep in mind that bilirubin rise will occur earlier if there is biliary tree pathology. If there is biliary tree pathology, suppose we got liver damage and at the same time we got biliary tree pathology, mean if there is problem in or injury in biliary tree. So in case of biliary tree pathology, this bilirubin will rise earlier, but in case of liver pathology like liver cirrhosis, this will increase gradually and slowly. Serum albumin level will be decreased in liver diseases because due to the reduced synthesis of albumin. We know that protein synthesis occur in liver. If there is any problem in liver, so the serum albumin level will be less than the normal value. Now let's come to all the alanine aminotransferases and aspartate aminotransferases. Both of these are present in the cytoplasm of the hepatocyte. Hepatocytes are the liver cells. These are present inside the cytoplasm of hepatocyte, but the ALT is also present in the mitochondria of the hepatocyte. ALT is not present outside the liver. So if there is rise in ALT level, so it tell us about the liver injury, because this enzyme is not present outside the liver. So this kind of abnormality and this pattern of abnormality is known as hepatic pattern, because it totally reflect the damages in liver. Now the third one is alkaline phosphatase and gamma glutamyl transferase. Alkaline phosphatase ALP is a name collectively given to several enzymes distributed in body, but main site are liver, GT. So now let's look to these enzymes. These are present in other tissue of the body also, but the AST and ALT are present specifically in the liver cell. These are also present in GAT, placenta, and kidney, but main site is liver. In liver, it is located in hepatic sinusoid and biliary tree canaliculi. Biliary tree canaliculi. These are also present in biliary tree canaliculi. So, alanine phosphatase level raises intra and extra hepatic obstruction with sinusoid obstruction. What? Sinusoid obstruction. If there is any pathology in biliary tree, these ALP will rise. If there is any pathology in hepatocyte, these ALP and GGT will rise. In contrast to ALT and AST, that will rise mostly in case of liver pathology. So now GGT, gamma glutamyl transferase, is present. These enzymes are present in hepatocyte and biliary tree epithelium. So increase in biliary tree obstruction. This kind of pattern in which the ALP and GGT increase this kind of pattern of disease, we call it cholestatic pattern, because these denote the disease of biliary tree more than the disease of liver. So now let's come toward the summary of this. That in case of biliary tree obstruction, AST and ALT will be raised but not too much. GGT will raise twice, while the ALP, as I have told, that in case of biliary obstruction, biliary tree obstruction, it will increase to 3 times, mean it will increase more. In case of hepatitis, AST and ALT will increase 3 times. As I have told that AST and ALT are mainly present in liver hepatocyte. The GGT will be raised but not that much. ALP will also rise but not that much. In case of alcohol or drug induced injury to hepatocyte, AST or ALT may be normal, but GGT will be raised twice. ALP may be normal. Now let's come toward the hematological test. The peripheral blood count is abnormal in many of the liver disease and give a clue about the underlying cause. Normocytic normochromic anemia reflect the GIT hemorrhages, whereas hypochromic microcytic anemia will be due to the chronic blood loss. Thrombocytopenia, there will be thrombocytopenia due to reduced platelets, because we know that in liver cirrhosis platelet formation is affected. So the next test is coagulation test. In coagulation test we have prothrombin time. Prothrombin time increase in liver disease, but if prothrombin time increase and we give a vitamin K and this reverse with the vitamin K, so this will not reflect the liver disease. But in case of liver cirrhosis, if we give a vitamin K, this will not reverse. So prothrombin time will increase in case of liver cirrhosis. The next investigations are imaging in liver. So first one is ultrasound. Ultrasound is non-invasive and used as first line test to identify the gallstone, biliary tree obstruction, thrombosis in hepatic vasculature. It detects splenomegaly, liver texture. It can also tell us about the liver texture. But Doppler ultrasound may tell us about the blood flow in hepatic artery, portal vein, hepatic vein. So Doppler ultrasound can tell us about the vasculature of the liver. Ultrasound can also tell us about the focal lesion like tumor if it is more than 2 centimeter. The next one is computed tomography and magnetic resonance imaging, MRI. So CT scan detects smaller focal lesion in liver, especially with contrast. If we do this along with contrast injected, so it can tell us about the focal lesion like tumor. MRI is good for focal lesion again like primary and secondary tumors. So the next one is cholangiography. What is cholangiography? In cholangiography we have magnetic resonance, cholangiopancreatography and endoscopic retrograde cholangiopancreatography. This and are percutaneous cholangiography. It tells us about the biliary tract pathology mainly and the pancreatic duct pathology. So it detects pancreas and biliary tree abnormality. The next one is but we have to take a histological examination. So for histological examination we can take ultrasound guided liver biopsy or percutaneous ultrasound guided liver biopsy. And there are some non-invasive marker of liver fibrosis. This contain alpha 2 macroglobulin, hepatoglobulin, procollagen peptide 3 and tissue inhibitor metalloproteinase 1. So all these are the non-invasive marker of liver fibrosis. If these are present with us, so we can take an idea of the liver fibrosis. In next lecture I will try to discuss the detail of each investigation. It was just an overlook of all the investigation which we have in liver. So in the next lecture I will describe the most important investigation in detail. So keep with us. Thank you for watching.